Well, I want to thank everybody for returning. I think we got more than 50%, so that's pretty impressive. It's a lot of intellectual material to absorb in one time, and yet we have a whole nother panel to go. Prior to starting, though, some people said, well, what can I do? And my vision for putting this together was not only to communicate the importance of the ideas. I don't expect everyone to integrate them all in one meeting, but at least be engaged enough to say, boy, maybe there is a solution to this problem. And it is consistent maybe with the principles that built this country, and it's practical as well. And I will not have enough time to outline that entire solution, but give you an idea that it is possible and practical. But then the second challenge is, okay, if I know that, how would I ever get a politician to propose this and change the course that we're going on? And that's not something I can answer. But I can try and propose a vehicle through which we may be able to make that occur. And really, this group is the first group, at least since 1992, that I've tried to do that with. And what I want to engage you to do is, instead of yell at the TV, is to say, you know, none of us obviously, I can't run for something. I'm practicing medicine. You know, Yaron always likes to say, well, we get the politicians we deserve until somebody steps up and decides that has the right ideas to run. But that's not what I'm going to do. But what I want to do is provide a vehicle through which we all can do a little bit of educating. And so we established this ambassador program. There's a physician ambassador form that I hope every physician has received. And if you think that these ideas are important, if you think this really is an issue of life and death, not just for your future health care, but that of your kids and your grandkids, then I think it does deserve some action. And if you think that the action in the course that we're describing today is appropriate, then I encourage you to join the organizations that are presented here on this form, and then set up an office education system. And when you join AFCAM, we have a little example of a display out there with some of the material that we will proliferate so that you can educate your patients. And this is sort of just a person-to-person education, because you won't be able to practice real medicine unless we can free it up. And your patients won't get the best care unless we can maintain freedom of choice. So although it may seem too political for some of you, I think it's extremely important that even at the end of every medical little interaction, you say, oh, did you see the materials out front? You know, we're trying, and you know, if you have questions about it, we have some things. Now, that's the doctor's end. Well, what about those who are not doctors? What can they do? Well, we have another form. The role of the medical freedom ambassador, okay? And very similar role. And basically, what I want you to do is be able to volunteer, whatever, once a week, twice a week, 30 minutes. And I want you to be the vehicle through which we support the doctor's offices that set up these systems. So that you'll visit, you'll maybe have 4 or 5 doctor's offices you visit, and you visit them twice a month. And you make sure that their waiting room is filled with the right materials. You educate yourself as we provide you with materials so that you can interchange with people, interchange with their office, train their office staff. And also, we want the doctor to commit to sit with you 15 minutes twice a month so you can tell them, because they don't have time to read anything, what the new piece of material you brought to says and why, and have them ask you questions about it. And basically, what drug reps do in doctors' offices, I want to make our medical ambassadors do with the proper medical idea, with the proper ideas. So this system won't work overnight, but in fact, if we all act a little bit, it will be surprised how much it will grow, because we're right. Our ideas are right, and truth will pervade if we don't not act. So liberty is eternal vigilance, and we need to do a little bit of it, each one of us. So please fill these out and participate. Now, my talk is next is supposed to be the solutions, but we're running quite a bit over. So I'm going to try and summarize how we solve this problem. And we will be I produced a plan with myself and Dr. Rizza and Dr. Laporte that tried to take our principles of individual liberty, personal responsibility, free market economics, recognize that all of those have been distorted by the improper use of government force, then look at each of the three markets of healthcare currently. We have the private sector, we have Medicare, and we have Medicaid, and systematically look at each one and say, where is the inappropriate use of government force? How can it be eliminated, either slowly or quickly? And in fact, it comes out to about 7 fundamental steps we need to do. And in the private sector, we've already gone over it. It may seem so simplistic. Oh, you're just going to change the tax code and that's going to change everything? Well, that's like as simplistic as saying, you think you're going to get rid of all those symptoms by just giving someone one antibiotic? Well, it does work that way if you find the proper problem. And that really is one of the fundamental roots politically of the problem. So once we change the tax code, we don't have to change anything else about the employer system. We don't have to mandate employers change X, Y, or Z. Once that code changes, employees will start to learn, hey, I can take those same dollars and not pick the plan my employer picked. I can pick my own plan. And then I won't have job lock. I won't have all these other problems, right? And the other thing that will happen is the market for individual insurance will grow tremendously. Currently, it's less than 4%. Now, so that's step one. But step two has to happen at the same time, and that is getting rid of the insurance mandates. That is, insurance companies today have this host of mandated benefits that they're required to have in every policy, and it's different in every state. And some of them are things you'd naturally choose anyway, but some of them aren't, and they raise the cost of insurance. Now, each mandate, I have this just shows about 200 of the mandates around the country, and you can read through these. But basically, each one that adds, it only adds 1% of the cost of the policy. But you have 50 of them, and now your policy is 50% more expensive than it could have been if you chose the menu of benefits that you want on your plan. So all we're saying is let people have the freedom to choose and pick their actuary and their insurance company and let them decide if they want hair replacement if they go through chemotherapy or not. Let them decide if they want psychiatric care or not, or chiropractic care or not. Or, there's a whole variety. There's tons of benefits. But the point is, when we're trying to ration between dollars we spend on Medicare and dollars we spend on food and vacation and other things, we may rationally choose not to have the same benefit that our politicians chose to write into law. We may have different ideas than they do. And there's no reason we shouldn't have the freedom to pick those. Now, on top of that, the government restricts what states you can buy your insurance from. So I can't, if Texas has a lot better laws and they have a better benefit plan and insurance companies can write a cheaper plan, I can't go buy that. So 2 very simple steps we can do to free up the market is 1, at least allow to purchase insurance in other states. So at least we have 50 choices of plans. But then 2, we need to deregulate the insurance industry to provide proper and cost-effective insurance. Just one example of how stupid it is. I had a young patient who wanted to find health insurance, but he had pre-existing condition with an eye problem. Now, he could actually afford all the eye care he'd ever need for the rest of his life, because it's just not that expensive. People spend more on their VCRs or TVs than their eye surgery would be. So, all he needed was a policy that covers everything else but his eyes, but it'd be illegal for them to write that. So he's going uninsured for everything else because of that, just because the laws are set up. And that's just a small example of the way government force interferes with the exchange between individuals and companies.